Today we will discuss visual pathway, their lesion and the reflexes. Visual pathway, it starts with the eye. This is eyeball. First we have to make a well level diagram. This is our midbrain at this level of the superior colliculus. At the superior colliculus, this is the crus cerebri, this is the substantia nigra, this is the red nucleus, this is cerebral aqueduct, and this is periaqueductal gray matter. My tongue speaks loud. My tongue speaks not loud. Not lateral lemniscus is not up to that limit. Here is the pretectal nucleus. Here is the adenovirus nucleus, oculomotor nucleus. Okay, now here is the lateral geniculate body of the thalamus. Now this fiber is coming. Okay, and here is the occipital cortex. Okay, now we have to make the diagram. This is the visual field. First we have to cross the nasal fiber. Like this, and the temporal fiber is going same side like this. Now this is the lateral geniculate body. It is divided into 6 regions. 1, 2, 3, 4, 5, 6. Now the contralateral fiber, this is the ipsilateral one. Nasal fiber is contralateral. It is going to 1, 2, 3, 4 and the 6. Just to memorize, cricket में 1, 4 और 6 रन का बहुत महत्व है, इसलिए this is, and the rest, and that is going to 3, 4, 3, 5 and 2, 3 and 5. Same here, 1, 2, 3, 4, 5, 6, and this is the contralateral. Contralateral will go to the 1, 4 and the 6, and the ipsilateral will go to the 2, 3 and 5. Now this is the geniculocalcarine tract. Geniculocalcarine tract. Okay, from lateral geniculate body to the visual area. So, and here is the visual field, which sees opposite side. So this is the field and it is showing the opposite side. We have to make like this, and this fiber is for nasal side, which is showing the temporal field. Okay, and here also okay. Now the lesion, this is the lesion at the optic nerve. This is lesion at the optic chiasma. This is lesion of the optic tract, and this is lesion of the geniculocalcarine tract. Now what happened if this will occur? This is the, we have to write down here just visual field, eyeball, the optic chiasma, optic tract, this is midbrain, this is lateral geniculate body of thalamus, this is occipital cortex. This is geniculocalcarine tract. Okay. Now this is the visual field. A. A, B, C, D. A is what? Lesion of the optic nerve. Lesion of optic nerve. This is lesion of optic chiasma. Which optic nerve? This is the left and this is right. So lesion of left optic nerve. Now lesion of left optic tract. C is lesion of left optic tract, and lesion of this is not we have to cut all this, only the superior fiber. Okay, so lesion of superior fiber of left geniculocalcarine tract. Now what will happen? Lesion of the left optic nerve. This is now both sides, the temporal and the nasal of left side, temporal and the nasal field, both will affected. This is left and this is of right side. So what will result? The left anopia. Anopia. Now lesion of the optic chiasma. Optic chiasma, both nasal fiber affected. So both opposite. Yeah, this is temporal side. Both temporal side will be affected. Here is we have to write down notebook. The shaded shows the lesion or affected area like this. So this will be bitemporal. What will this lesion is called? Bitemporal hemianopia. Bitemporal hemianopia. Now the lesion of the left optic tract. Here is the lesion. This side in the this fiber is going the nasal side. In the left, this is the left, and the nasal side will affect. And this will go to the here. This will go to the temporal side, right temporal side. This is called contralateral homonymous hemianopia. Now what happened in this lateral geniculocalcarine tract? Geniculocalcarine tract, this superior fiber, lesion of superior fiber. So this is the superior. So and same with this, that here the superior fiber, so inferior. Everything will be opposite. So this is contralateral quadrantic anopia. Contralateral homonymous quadrantic anopia. Okay. So this is all about the visual pathway. Thank you. Now coming to the macula. This is the eyeball. This is optic nerve. Here is the macula. In the normal eye, we see there is only cones present in the macula. So this is the normalcy. From all sides, from the macula we see. And the macula, it will be affected in case of macular degeneration. Macular degeneration. Okay, and there is one case when there is a macular sparing. Suppose this is the macula, from everywhere we can't see except macula. This is called macular sparing. It occurs in retinal degeneration and glaucoma.